I think the session I moderated was very interesting for several informations, novel informations we got on the metabolic alterations which are responsible presumably of the derangement of cell biology. Professor Costanzo showed that the results of the accumulation of glycogen in the cell, and this somehow alters the metabolic pathway of the glucose. This impact on the energy of the cell. This means that is a potential window of opportunity to novel therapy, target therapy to restore the metabolic pathway. The other aspect is that the more patients reach the adulthood, this is a good news thanks to supportive therapy such as immunoglobulin therapy, or also the better way to treat malignancies that complicate the course of natural course of this disease, but means also that new aspects of the disease appear, such as diabetes, type 1 diabetes, and also liver chronic disease, which seems is similar to steatotic liver disease. To recognize these entities means to face them and to prevent the worsening of the phenotype. The other interesting aspect of the session was that the therapy, as shown by William Whitehouse, the therapy with dexamethasone does imply side effects on the endocrine and the diabetes of these patients, and so this is by this point of view is a new therapy, not resolutive therapy, but is a supportive therapy that is there are no side effects in this. But the more important questions that have been raised by two young researchers, who are Margherita Rossi and Giuliana Giardino from Milan and Naples, is that they are approaching new strategies to set up a gene therapy setting to definitively cure the disease, because the problem with ET is that there is no curative treatment. This is the big problem that many researchers in the world are facing. There are no conclusive data. We are only in a preliminary phase, but of course this is the hope of all the families, of all the doctors who treat this terrible disease, and we hope that in the future, we don't know when, we can offer to these patients a gene therapy approach.